All right, we are live. Thank you, everyone. This is our monthly show. For this month, we're going to be talking about suicide prevention and also just bringing everyone to the awareness of how we can prevent suicide and how we can, um, come together as a community to eradicate, people actually committing suicide if we can. I have with me today Sonia Navarro. I'm going to have her introduce herself from DBH, Department of Behavioral Services in San Bernardino. So please introduce yourself to our audience, Sonia.
Yes, thank you so much. I really appreciate the invitation and being able to be here to speak a little bit about suicide prevention. I think this is an important conversation. My name is Sonia Navarro, as you heard. I am a program manager for the Office of Prevention and Early Intervention. That includes the Office of Suicide Prevention as well, and it is with the Department of Behavioral Health with San Bernardino County. I've been now with San Bernardino County for over 30 years, but I've spent the last approximately 20 years now here with the
Wow.
Department of Behavioral Health. So I have had an opportunity to grow and learn much about mental health services in our county and everything that we're doing to be able to provide those services to the community.
Well, thank you. Wow, that's 20 years. Did you say over 20 years?
I believe so. I'm bad with math,
Wow.
but I think it's about 20 years.
Yeah, thank you for being here so much. So we are live on a lot of platforms, LinkedIn, YouTube, Facebook, etc., etc. So and then this people will also watch the after show, and
Okay.
so we're hoping we can get a lot of people to click on this and actually learn some things from you. So when we're talking about our topic today is breaking myths surrounding, and saving lives. All the myths that surround suicide. Can we just talk about some of those today?
Some
Right?
of those myths, yes.
Yeah, some of those myths that you've heard in since you've been doing this for a while. Can we identify some of them and then just talk to them?
Yes, yes, absolutely. So, one of the biggest myths that I'm sure some of you have heard is the myth that uh, talking about suicide puts that idea into their head. That is a
Mm-hmm.
myth. Talking about suicide does not put the idea into someone's head. And I like to use a lot of examples. So, bear with me because I like to put things in context. But I always say it's like when you tell your kids that it would be a good idea to clean their room. It doesn't typically happen. It doesn't put the idea in their head, and they don't do it. So, rather, in fact, it's actually important to have open conversations so that we can prevent it. So talking about it actually helps and doesn't hurt.
Absolutely. Thank you for that big. That's the one of the biggest ones, right? It's like if you talk about it, then going to think about it. But you're saying that's not true, because someone who wants to commit suicide or who is trying to make an attempt is going to do it regardless of either you talk about it or you don't. Does that make sense?
Yes, yes. But again, the importance is to really to have those conversations and to talk about it, uh, to normalize it so that we can talk about it and we make it okay for people to talk about it and ask about it in different ways, to be able to connect those people to the appropriate resource and to
Resources.
get them the help that they need. Absolutely.
Absolutely. So, what are some of the risk factors that we need to consider? What are some of the risk factors? Somebody's listening to us and they don't know what to look out for. What are some of the
Mhm.
risk factors and what are some of the signs early on that we should consider, that we should be looking out for? The audience would like to know that.
Yes, absolutely. Risk factors, like can be like life throwing us some curveballs, right? We have some mental health struggles. Sometimes there's trauma. Sometimes there's substance abuse. Those can be like storm clouds that make everything feel a little gray. But recognizing those types of risk factors is key. So we want to think of, our mental health as being kind of like the forecaster of our mental health. And when you see that something, a storm perhaps, like unfortunately the hurricanes we're seeing, when those storms are coming, we prepare in advance.
Yeah,
So risk factors come in many different ways, shape, forms, and manners, just like warning signs. Sometimes if your loved one or someone you care about seems withdrawn, or you see that their mood shifts faster than than you're normally used to, that's a sign to check in. There's a long list of things. You and I, Dr. Marino, could spend probably hours listing all the different warning signs, but it's really about paying attention and offering a lifeline before someone drifts too far. And that's key, because warning signs aren't always what you would imagine that they are. I think people sometimes feel that because someone is sad or because someone is withdrawn, but it doesn't always happen. It can be that someone is showing us in a different way that they're struggling. So there's many different ways, and it's really just about paying attention.
Paying attention to changes too. I mean, if somebody who used to be really extroverted, or at least made connections with you, is no longer connecting with you, then you want to make sure that you reach out to somebody, ask how people are doing. I always say, our human connection is the best prevention to these things. Like, are you connected to that person? Can you call them and say, hey, what's going on? I haven't seen you in 2 days. I haven't heard from you. Is there anything, could I help in any way? If somebody's experienced a whole bunch of maybe a loss, losses of somebody significant in their lives, that could really become something that we need to watch out for. The ones who are bereaved,